in the ultimate men's movement with our host, Dr. Jack Rocco. Dr. Jack, I'm excited we're going to do a couple solo podcasts, but today's topic I think is so relevant because healthcare is going through the roof and taking care of your health is the best thing to do so you don't have so many expenses.
Exactly. And November is Men's Health Awareness Month. They don't seem to push it as much anymore. I had the No Shave November, which usually followed October, which was breast cancer awareness. But we're there again. It's November. And, as a men's clinic, I think we need to talk about, some of the issues with men and why men don't go to the doctor. What is the big deal about going to a doctor with men? I want to get into that. Have you ever run into that, Neil?
That's the really thing is we think we're so tough. We think we're so invincible. Then I finally got a mentor that told me, you need to start taking care of your health. And it was the best thing that happened to me because I didn't take care of myself at all. I didn't think it was a big deal. And now I think it's more of a big deal than ever. It's like, that can wait. No, it can't wait.
Yeah. And, I think, as guys, I've known so many of these guys, like in their 20s, they were big athletes in high school, their 20s, they start, 20s or 30s, they start building a family and they just get away from that gym. They get away from the gym, and they just neglect themselves, and, you ask any guy, it's like, you go to his garage, a lot of guys, you go to their garage and, their lawnmower is immaculate. They tune up their lawnmower, they tune up their weed whacker, but they don't give the same attention to their body a lot of times. It's, drinking with the boys or, eating chicken wings, these things really start creeping up on you in your 20s and you hit 30, life starts to drag you down. And before you know it, you've got an extra 80 to 100 pounds that I see so many guys that are 80 pounds over what they were in high school, as a senior. And it's, once you drive yourself down that toilet bowl or, that poor health, it is so much more difficult to get out of it. It's something that you really got to keep up on, in your 20s and 30s, but especially once you start hitting 40, I think that, and a lot of times that's that, fork in the road. You get to your 40s, and if you don't take care of yourself in your 40s, your 50s and 60s can be miserable for a lot of guys. So, I want to kind of go over like a lot of the, when you said you didn't want to go to, you thought you were just invincible. Was that the?
No, I don't think I did. I just thought the guy's health didn't matter. We just suck it up and keep going.
Mm-hmm. Yeah.
And that's it. Like, just who cares? Just ignore it. Got to keep pushing through. We're the providers. We got to go. And there's nothing else that we can do. Done.
Yeah. And especially if you're not sick. And I think a lot of guys are, fortunately, I think, for routine maintenance, most guys are healthy. So unless they get sick or have an issue, they're not going to the doctor. And I think a lot of guys, there's that perceived masculinity of weakness. I said I suffer from this as well. The idea of you hear so many women in the office, nurses or whatever. You're like, oh, I'm not going to be here tomorrow. I've got a doctor's appointment. And I was like, oh, it's like I wouldn't even think to take the day off to go to a doctor's appointment or have a late day. So it's just, I don't know what it is in our mindset that does that. It's just like if you tell someone you're going to the doctor, they're like, what's wrong? It's the first statement. And I think we try to make, if guys need later appointments, I think that's one way that we try to counter that. But, if you need to do a 5 or 6 o'clock appointment, I don't have a problem with that. We usually start later in the day. This isn't, in our office, it's not necessarily like the OR where you got to be up at dark 30 to get started. But I think that's one way that we've kind of countered that argument of, well, I got to work. But I think doing after hours or, later in the day appointments, is one way we try and counter that. And I think a lot of guys also, they're afraid of finding something out. I remember when my father was, when he was younger. Now he's always at the doctor, but when he was in his 60s or 70s, I'm like, Dad, why don't you go to the doctor? He's like, Jack, why do I want to go to a doctor? They're just going to find something. And I was like, well, Dad, maybe you have something, and, to be able to catch a diagnosis, to look at liver function tests or, blood work. And, if you start to see some of these early markers showing up, PSA is a big one. That's prostate specific antigen. Now that's an antigen, a blood test that'll come up early in the course if you do have prostate issues, prostate cancer. By getting that early test and at least having a baseline. So then, or if you see that it's slightly elevated, that's the perfect time to get it checked. Not when, the stuff is hitting the fan and you've got a larger tumor or something, God forbid. You want to catch that early, correct?
No doubt. Absolutely. If you don't catch it early, it's a problem.
Mm-hmm. And I think guys, I'm all in favor of male confidence. I think, I love a confident guy, someone who is self-assured. I think we all do. We all like those leaders that are confident and self-assured. But sometimes that can work against guys. They're like, no, I'm healthy. My father was healthy. My father lived to 90 and drank every day and smoked his whole life. And they get this, they hang on to, those one or two stories where those are not the norm. The norm is not, those, but men hang on to that top tier of health performers that they see in their life. And they just naturally assume that that's them. And it's not the case. But even if it's not an illness, and this is one thing that we try to really focus on, it's like, we don't really try to focus on illness per se, but more wellness, and the idea of healthcare, I think the word has been so perverted lately that, healthcare kind of equals insurance coverage. You hear it all the time on the news, I got my healthcare. Well, just having the insurance is not healthcare, and, the American system has really developed into an illness care model where, you diagnose a high blood pressure, you get put on high blood pressure pills. We try to catch these things before they develop. So yeah, if you're healthy, great. Let's start measuring you when you have some healthy markers. What is your baseline? Guys will come into the office in their 40s or 50s and they'll get a high blood pressure reading or they'll get a high LFT. And you really have no idea what their LFT, their liver function tests were when they were younger, when they were healthy. And fatty liver disease used to be related to alcoholism or, heavy drinking, where guys, you hear about alcoholic, fatty liver disease or cirrhosis. Those are more end stage issues. But we're seeing a lot of non-alcoholic fatty liver disease out there. And that is a function of the food, the processed food, the overeating, the constant insulin addiction. If you have a constant high insulin level and insulin resistance, you're like an insulin addict, that you need more and more insulin to get the same effect, or your cells get full of the fat that the insulin is pushing in. So that's a lot of the source of, non-alcoholic fatty liver disease. And that's something that you want to catch that early, that if you can cut back on the ultra processed foods, the stuff that's coming out on those is really, I'm glad that it's coming out, but it's scary. The amount of high processed food. I just read an article where the rate of cancer amongst individuals who had over 10 servings per week of an ultra high processed food, they had like a 50 or 80% increased risk of colon cancer. Just, and it was a good study. They followed these people for a long period of time. And I said, the ultra processed food that we eat is really driving a lot of this, a lot of the cancers that we see, the fatty liver disease, and just in general, poor health. When I see someone with visceral fat, and we've talked about this before, the guys will show you, that big belly, but then they'll pound on their belly and they'll say, yeah, doc, but look at this, it's all muscle, and that is the tightness of your stomach is the least valuable, but it's a common misnomer. When you pinch the fat, if you can pinch the fat on your belly, whatever fat you're pinching on the outside, that's almost like a normal distribution of your fat. When you don't have that fat to pinch, but they still have the big belly, their abdomen is just swimming in fat that's below the muscle layer. And, that surrounds the heart, it surrounds your organs, your intestines. So things don't work as well. There's a mechanical nature to your bowels and your organs. And if they're sludged down with fat surrounding them, the small intestines, the large intestines, they just don't move. They don't have that same motility that they would have, without that fat. So, someone says, oh, I'm still in good shape. Look at this. I got tight abs. Well, if you've got a beer belly and you've got that visceral fat, that's something that I think you need to monitor that. There are some people that are doing, MRIs or CAT scans to kind of quantify that fat. And there's nothing wrong with that, but just identifying, what is your waist circumference, compared to where you started. If you're starting to get up into a larger and larger pants and you still think you have a tight abdomen and you're not working out, that's a wake-up sign that, you are at risk for further health issues down the line. And, the best time to catch it is when you don't have those problems. Those guys, right, Neil?
Yeah.
They tend to be beer drinkers, and it's not just guys. Women get it well. And it's, I said that, I said, I love my guy friends. My guy patients, but sometimes you shake your head. You're like, listen, buddy, we're all in the same boat. There's no reason to be, ashamed or embarrassed by these things. And the sooner you find out how to get rid of it, we have products that will help with stabilizing your own GLP-1. Right. So that you don't need to go on those GLP-1 drugs. If we can help you to manufacture those in your own intestines is where it's made, that's the best thing you can do. So, and I think that, men, it's just like to have that support. If guys are going through a divorce, having a spouse or a loved one, a partner, that encourages you to take control of your health, or someone that you work out with, I think that's another very valuable thing, to maintain those relationships in your life. Otherwise, guys get depressed, they go home, they open a beer, and then, that's it for the night. But try to encourage them to be proactive on it.
No, they're not proactive. It's a problem. And how do you encourage them when they come in to see you the first time? For it might be one real serious, there's more underlying issues coming for men's health.
Yeah, and I think a lot of it for me is just the approach on how you address guys. I think, my patients, my male patients appreciate my perspective, as a male, as a middle-aged male. I'm not one of these, 30-year-old new grads out of school, hyper idealistic. I'm suffering and managing a lot of these issues as well myself. So I think your physician, having a rapport, a camaraderie with your physician is a very important thing. That it's not a burden. I think a lot of guys are like, I hate going to that guy. He always wants to put me on something. He always wants to, and we try to work with it, and we try to, stick with more natural things. If you have a major health issue, I'm perfectly happy, diagnosing it and getting it set up. But if it's something serious, we'll pass you on to, your family doc or someone that we can recommend that's good for treatment for you. But, getting it diagnosed and feeling comfortable to come in and get that diagnosis, you can't treat a problem if you haven't defined it or you know what the problem is.
Right. And those problems can become a big issue.
Absolutely. And I think a lot of guys are just, they're embarrassed by it. They don't like getting naked in the exam room. They're like, and like I said, it's just something that we do so frequently. I'd like to encourage guys, just, we'll make you feel comfortable. It's not a daunting thing. When I said, this is who we deal with, like if you go to if a woman goes to a gynecologist, they have to feel very comfortable with them. So I think men also need that relationship with the physician, that they feel comfortable, someone that has been through some of the issues seems to be important for me.
No, I think it's definitely important. And without it, it's like, what's happening here at the end of the day,
Yeah,
for sure.
And I think guys also, we still carry some of those things from when you were a child.
Yeah.
I find men to be, on the outside, we've got a hard, coarse outer shell. But as I get into conversations with guys, it doesn't take long for that outer shell to kind of melt down. And, I think men at the core are often more sensitive than women when it comes down to it. You start talking about their health and they may have an issue. They're hyper aware of it, and they're hypersensitive to it. They want to do what's right. They want to improve themselves. And it's just a matter of, breaking through that embarrassment, breaking through that comfort zone. And then those guys, oftentimes they're my best friends. They're my best patients. The guys who come in, and if you can earn their respect, earn their understanding, and they feel like they can say stuff to you. And I'll often, I'm not afraid to, ask the questions that I know need to be asked. Guys will come in, for years I've seen, typically when a man comes into the office, he's usually with his significant other, more often than not. Women frequently come by themselves, but guys often come, with their significant other. And if they're talking about, sexual issues or personal issues, a lot of times they don't want to bring that spouse in. But I know the questions to ask. I know the questions that you should ask. And I'll walk you through those and get you to think about those questions that, guys say, well, if I'm not sick, what am I going to say? Well, I know what you should say. I know what you should look for. We know what the issues are, and, I'll bring them up for you. So it's not something you have to, prepare or rehearse for. I think guys don't want to come in and act like a fool or seem like a fool if they don't know what to ask. But I walk my guys through those questions and, get them to ask what they need to ask.
That's for sure. And so I think that anything else to add, what they should do is just come here, right?
I just, I think, and it, you don't have to come to me. I mean, we've got an audience across the nation. I mean,
and all over the world. Maybe some men are going all over the world that are hearing you, with the worldwide reach that we have.
Yeah, it is a universal problem with men and their health. So you need to find someone that you trust, someone you feel comfortable with. And once, if you get a good rapport with a doctor, so many guys will, especially doing orthopedics, everyone loves talking about their orthopedic issues. Hey, doc, my shoulder.
Yeah.
So I'll have people come up to me in the produce department of a grocery store or at a ball game. When we were in Altoona, Pennsylvania, my kids they almost hated going to the baseball game. We'd go to the minor league curve games. And, I'm walking through there and it's like, hey doc, my shoulder, my hip, my knee. Once you break the ice with those guys and, they know they can trust you, they'll come up to you for everything. And I don't mind that at all. It's better those guys than the ones that are cowering away and avoiding the conversation. So I'll make them comfortable for you.
All right. That's unbelievable, Dr. Jack. Best place people can go is the Ultimate Men's Clinic, and follow Dr. Jack and the Ultimate Men's Clinic on all the different social media. You'll find it, and appreciate it. And we look forward to our next conversation.
Thank you, Neil.
All right. That was a special simulcast of the Neil Haley Show in the Ultimate Men's Movement, guys.